Neonatal resuscitation. Suppose you are working in a neonatal nursery and you receive a newly born baby. What things you will do next? You should know that, or you are called to a gynae OR before the delivery of the baby, so that the baby can be hand over to you for further resuscitation. What things you should have before receiving the baby are: you should have a piece of cloth towel for drying up the baby and for wrapping the baby, a warmer to keep the baby warm, suction apparatus that may include bulb or the suction catheter, and then for positive pressure ventilation you need an ambu bag with mask or endotracheal tube with a laryngoscope, and for medication you need adrenaline. You should have these things in hand before you start the neonatal resuscitation. Now you receive a baby, you will check for, you should know beforehand what are the prenatal what is the prenatal history of the baby. Are there any risk factors? The risk factors include whether the baby is preterm, or there is any congenital defect seen on ultrasound, or there is any maternal problem, like there can be placenta previa or placental abruption. Anything can be like this. There can be any risk factor. So if there is no risk factor, you know that there is no risk factor, and you see that the baby is breathing and crying and he has a normal tone, he's actively moving his limbs, he's pink, this means that this is a well child. You will only dry the baby, keep him warm, wrap him, and you clear his airway with a bulb sucker and hand over the baby to the mother for feeding. So this was how you deal with a normal child. Now, if there were risk factors, then you anticipate that the baby might need resuscitation. Now, the baby is handed over to you. You have to assess three things. Number one is breathing, whether the baby has his own respiratory effort or he is crying or not. Then his heart rate, and the heart rate should be more than 100 in a normal baby, and he should be breathing on his own, a normal baby. And what is the color of the baby? He's pink or he's blue. Normally the baby should be pink all over, right? Now if the baby is not breathing, there is no breathing, baby is in apnea, there is no respiratory effort, what will you do next? You first stimulate the baby. Stimulate the baby means that you'll rub his back or tap his toes. Now if the breathing initiates after stimulation, then it's okay, but if even after stimulation baby is not breathing, we will go for positive pressure ventilation. Positive pressure ventilation means that you have to give mechanical ventilation from outside. There is no respiratory effort of own, there is no own respiratory effort. We have to give the positive pressure breathing from outside, ventilation from outside, and this is done using an ambu bag with a mask. Later you can use endotracheal tube or mechanical ventilator as well if long-term positive pressure ventilation is needed. Now you will continue positive pressure ventilation until the baby starts breathing. The second thing you should know is the heart rate. Heart rate, if normally it's more than 100, but if it is less than 100, then you give the positive pressure ventilation until the heart rate becomes more than 100. More than 100. But even after giving positive pressure ventilation, if the heart rate is not increasing, rather it is decreasing, then if it becomes less than 60, then you should go for chest compressions. Chest compressions, there are two methods of giving chest compressions. Number one is that either you Encircle your both hands around the chest of the baby and give the compression with your thumbs. And now you have to push your thumbs so that the sternum is pressed about at least half or three-fourths of an inch. Only then it would be effective. Or you can use the second method, that is you can use the index finger and the middle finger, and you have to push like this, give the compressions. Now compressions should be with a ratio of 3 compressions to 1 ventilation. You'll give 3 compressions and then ventilation with umbo bag, then compression, 3 compressions, then ventilate. You have to continue the chest compressions until the heart rate approach 100 or it becomes more than 100. Now, in the worst case scenario, if even after the chest compressions the heart rate is not increasing, it's still less than 60, then we'll give him epinephrine IV, and the dose is 0.1 to 0.3 ml per kg, and you can repeat the dose. 3 to 5 times after 3 to 5 minutes. Sorry, you can repeat the dose after 3 to 5 minutes, right? If the baby is not responding. Now you will continue the positive pressure ventilation until the baby starts breathing or until his heart rate becomes more than 100. You will continue the chest compression until his heart rate becomes more than 100. If there is no breathing, despite all these efforts, no heart activity after all these activity, then the baby's color is not turning pink. You'll continue this resuscitation for only 20 minutes, and thus. So this was all just a general review of neonatal resuscitation. Quick overview of APGAR score. APGAR score are a set of 5 features that we check in a newborn infant at 0 minute, at 1st minute, at 5th minute, and at 10th minute. Each of these 5 features have the maximum score of 2, so the total score is 10, and 7 to 10 is normal. If it is less than 7, this means that you need resuscitation. These features are: A is for the appearance of the baby, means the color of the baby. P is for pulse, his heart rate. G is for grimace, facial expression. A is for the activity, and R is for his respiration. Now, if the baby is blue all over, he's cyanosed, then his score would be 0. If his body is pink, but the extremities are blue, then the score would be 1. And if the baby is pink all over, then the score would be 2 maximum. This is normal. So all of these would be normal, and this means the baby is there no more. Anyway, pulse, if it is normal, we know that this is more than 100, the score would be 2. But if there is no pulse, no heart activity, score is 0. If it is less than 100, it's 1, and if it's more than 100, the score is 2. Now we come to grimace. If there is no activity, no grimace, the score is 0. If there is mild facial expression, then the score is 1. And if the baby is coughing or sneezing, then this means that the score is 2. There is more activity. Activity here, if there is no activity, baby is not moving, no tone, no floppy baby, and the score is 0 then. Score is 1 if there is only mild flexion movements. Flexion only. And if the baby is active and there are flexion as well as extension movements, the score is 2. Now, respiration. If there is no respiration, score 0. If there is irregular respiration, score is 1. And if the respiration is it's normal respiration and the baby is crying, then the score is 2. So this is an overview of EBGAR score.